Today's health screening has become possible because somewhere last year we had an issue, and then there was a committee that was set. That's the ad hoc committee on health. So after their reports, they gave some recommendations. One of it is that we should hold a health screening for the students. So based on that, we started preparing to come and then host this first ever health screening for the school. Today we've had a lot of tests that has gone on. So we've taken their vitals, we did glucose test, we did malaria test, we did HB test, and then we checked their weight, height. That one we call it BMI. So we've done all that, and we've had 1, 2, 3 cases which we have referred to Combe Hospital. Combe Hospital is where all the students are referred to whenever they are sick from the sick bay. So we've referred them to the hospital. They are currently receiving attention. Yeah. Health is a very, very vital aspect of our lives, and I'm very passionate about health. So when I became the global vice president, it was one thing on my heart that we will do this, because I look back and I know that we've not had anything like that before. So it was on my mind, and it was a wish that this thing can come on. And thankfully today it has sponsors, and then this thing is coming, is here today, and then we are all experiencing it. So currently they are having talks on cervical cancer, nutrition, and then they are doing breast screening too. So we are hoping that by the end of the day, all these talks that is going on, it will sink in their minds, and then it will reflect in their health going forward. One thing I have noticed is that death brings out a lot of bacteria and all that. So in their dormitories, in their bathrooms, even in their classrooms, they should keep it neat. Because if they don't do that, the bacteria, they are in the air, so they can easily contract any disease. And so they have to take good care of their hygiene, their environment, and that will help them have a good, healthy body. With the help, for now, we know that this is our school. So for now, this is where we are. Yes, in the future, if government wants us to partner with them to do this screening elsewhere, we are open to suggestions. To say thank you to our sponsors, they've really helped us. First on the list is the MP for Ekuapem South, who is also a beacon. If I say beacon, she is also an old girl. She supported us very well, and we are grateful to her. We are also grateful to Octagon Pharmaceutical, Top Up Pharmaceutical, R&B Clinic. We are grateful to Dr. Henrietta Fishen, who also gave us some drugs. And then the PA, that's the Parent Association of Aburi Girls. And then the headmistress, she's been so supportive. Getting us to this far, she has been so supportive. So I thank all of them, and I say God bless.
Indeed grateful to the old girls for having this program for us. It's not out of place in our lives once in a time just to check on our health status. So for them to have this health screening for all the girls to take part, not just the students alone, but staff and all those in the community, I think it's a very great gesture, and we are grateful to God for that act. With this, and from the feedback we've had from these students, from their health, I realized that we need to take very seriously their hygienic life, their personal hygiene, and how to keep themselves, especially because they are adolescents, and sometimes their menstrual life, how they need to take their bath, how they need to, it doesn't mean they don't do it, they do it, but it's an eye-opener for us as management, to help the students in that wise. So my advice to students that we should keep on checking on our health. Even when they go home on vacation, as they are in school, they shouldn't take anything for granted. If they feel weak, sick in any part of their body, They should come out to tell us what exactly the problem is. As a school, would appeal to sponsors to help us to come in. It's a fine initiative. Awoga, PA, and Combe Hospital, Presbyterian Hospital. Our appeal to the public is that we need sponsors to come and help us so that we have these kind of health screening often, because it's a good thing, it's a good practice, and it's good for the whole community.
The Ghana Academy of Nutritionists and then Dietitian, we came to, some of us are members and we are all students, so we came to contribute our quota to educate the girls here about their diets, and then we did screening on their weight to see whether they are within range or if there is anything to advise on. And so that's it. And we have realized that a lot of the girls, we realized a lot of them were overweight. Then there was underweight. So the ratio of those who were underweight and then those who were overweight was high. And looking at what we saw, we attribute it to the fact that what they are eating could be the reason why their weights are up and then some of them are underweight. Questioning them, we realize that some of them would rather skip meals and then eat what is in their box. And when we question and to find out what was in their box, it was all sugar sweetened beverages, processed foods. So we advise them that they should get back to the dining hall and then take the dining hall foods. Some of them complain about the fact that the dining hall food is not enough. But we told them that the dining hall food should be enough. The portion size that are being served are quite enough for them. They will only have to balance it. Maybe instead of getting sugar sweetened beverages in their box, parents can rather give them money to buy fruits. Instead of buying the sugar sweetened beverages or other foods, parents can give them money to buy egg. At least if your child can take in an egg a day, it will complement the protein that they may be lacking if they are not getting enough. So those are the advice that we gave them, and then we realized that at least it's good. It's good. The educations they've gotten out of this is going to help them a lot. Yeah, so we are advising parents that gone are the days when we come to school and then you know that it is you and then the dining hall food. This time they come to school and then their boxes are full with carbonated drinks, sugar sweetened beverages. It is a no. The sugar sweetened beverages are not helping. They contain empty calories, too much sugar. So please, parents should take this advice. Ghana as Academy of Nutritionists and then dietitians are saying that you should go for foods that will give enough nutrient to the children than the foods that will only add calories to their bodies. So we are advising they should give them enough fruits, they should give them enough proteins, and then they should check what they put in their box.
Ask me, I think this shouldn't be the first, neither should it be the last. So Madam Aoga, Global Vice, yes, and please talk to your team. We would want this done periodically, if once every quarter, that would be good. And you know what? It will actually cut down health costs, because once you catch any developing ailment, you're able to cut down the cost than to wait till it blows overboard. So I think it's a good thing. We should continue. Let's get sponsors, because I think that's another challenge that we had. we need sponsors. Thanks to Casa Preco Company Limited, they really sponsored us, gave us some water and some other things. And as the Akan will say, I think they have to be very, very conscious of what they eat, and especially go to dining hall to take what is there, because whatever is being served there, their health is being taken into consideration. Because this, we have professional matrons, I think there are two, and obviously the food combination that will be given them is the best for them. What they have in their trunks and their chop boxes are just supplementary. So take what is in the dining hall. Don't skip your meals, because it is building you. You don't know where you are going to end up in future. You may have to go serve somewhere. You may have to go to maybe UN missions, even those who want to join the military. And in the training, if you are not used to taking what is available, then you are going to have challenges. And I want this, I want that. Anytime they are asking parents, buy me pizza, the fried rice, and all those are the junk foods. It's nice once in a while, why not? It's good to have a cheat day. But what we've observed is some, because of the type of food that they take, maybe going obese. So let's watch what we eat, and let's ensure that we have clean environment wherever we go. And with that, we're going to have very, very well turned out, groomed, healthy ladies.
Grateful for what the old girls have done, their unwavering support and trust. We appreciate everything. I would also like to thank them for organizing this event. Their perseverance and dedication have truly been remarkable. And I would like to say that this event that has been organized by the old girls has been truly helpful, because some people, I know that they were really sick, but because of they were tired, and you know that if they go to the sick bay, it will be too stressful. So the fact that the old girls were able to organize this event and make it, of course, free for everyone, we appreciate it very much. When this program was organized, I got to know my height. I actually did not know my height. And some of my friends actually found out that they were underweight, which they actually did not know. So I don't know whether it's because of the not eating enough food or those things, but because of this event, they got to know that they were underweight, and I know that they will be putting measures in place to fix that. And with the other factors that we also put in place, such as the breast treatment and everything,